All right, let's get into it. Today's briefing is a direct hit on the USMLE and PLAB boards, and we are targeting a super high-stakes topic, Pancytopenia. This is one you've absolutely got to know cold.
So I want you to burn this idea into your brain. The bone marrow isn't just making one thing. It's the master factory for all of your blood cells. And when it goes down, it's not just a slowdown, it's lights out. Every single production line goes dark. That's the core crisis we're dissecting today.
And, just quickly, here's our mandatory disclaimer. Remember, this is all for educational purposes, specifically for your international medical exams. This is not medical advice. For any real-world clinical decisions, you're obviously going to consult official guidelines and a specialist.
Okay, so we're talking about the master factory failing. What does that actually look like when a patient walks through the door? Let's break it down.
The term is Pan-Cyto-Penia, and if you just break down the word, it tells you everything. Pan means all, cyto means cell, and penia means not enough. It is a catastrophic global failure of all three blood cell lines. We're not just talking about anemia here. We're not just talking about a low white count. Everything is in the red. It's the ultimate alarm bell. So when you see this total system failure, you have arrived at a critical decision point, a logic gate. And for your exams, you know this, identifying the next best step is the whole game.
Just picture the classic board question, right? You get a patient who's got this profound fatigue. Well, that's the anemia. They're bruising super easily, no platelets, and they have a fever because they have basically zero neutrophils to fight off any kind of infection. Then the labs come back and just scream at you. Hemoglobin is 6, platelets are at a terrifying 10,000, and neutrophils are almost non-existent. So the labs are back, and your intern, trying to be helpful, immediately suggests checking B12 levels. It's a common reflex, but let's be sharp here. Is that the right move? Is that the most precise next step? Nope, not even close. That's like checking for a missing ingredient when the entire factory has been bulldozed. A B12 deficiency gives you huge, funny-looking cells. It doesn't give you an empty marrow. So this brings us to the correct algorithm, the one that gets you the points. Step 1, you confirm what you already suspect. Low counts on all three cell lines. Step 2, you look at a peripheral smear. And what you'll often see is, well, not much. The few cells that are there might look perfectly normal. There just aren't enough of them. And that observation points you directly, with no detours, to step 3, the definitive test. The next best step on your boards is always going to be the bone marrow biopsy. Getting the biopsy is only half the battle, right? Now you actually have to look at the sample and figure out what's going on inside the factory itself. And really, the biopsy result sends you down one of two main paths. It's a critical fork in the road. Is the factory empty, or is it packed full of something bad? If your biopsy comes back hypocellular, meaning it's just empty space replaced by fat, you're looking at aplastic anemia. But if it's hypercellular, stuffed with scar tissue or cancer cells, that's a whole different problem we call myelophthisis. For today's mission, we're focused on that empty factory. Aplastic anemia is what you diagnose when all that blood-making tissue is just gone. It's been replaced by fat cells. The factory didn't just run out of raw materials. The whole building has been demolished. And for your exam, you have to know the high-yield triggers for this. What causes the demolition? We're talking about classic drugs like chloramphenicol, viruses like parvovirus B19, and of course things like radiation and environmental toxins. These are your prime suspects. Okay, now let's gear up for a classic USMLE showdown. This is a huge board trap. When you see Pancytopenia in a kid, your mind has to immediately pivot to the inherited marrow failure syndromes. This table is everything. You need to know these differences cold. On one side, you have Fanconi anemia. The defect is in DNA repair, and the result is a total system crash, true Pancytopenia. Then you have Diamond-Blackfan anemia. This is a ribosomal protein defect, and it's much more targeted. It only takes out the red blood cells, which we call a pure red cell aplasia. So what's the big giveaway? It's the physical clues. You gotta look at the patient. In Fanconi, look for absent or underdeveloped thumbs and short stature. For Diamond-Blackfan, they might also have abnormal thumbs, like triphalangeal thumbs, but their white cells and platelets will be totally normal. It's that simple. Look at the thumbs, look at the counts. That's how you lock in the diagnosis. All right, let's do this. Time for a high-speed review to really lock these associations into your brain. Make them automatic. Ready? You see a marrow that's been totally replaced by fat? What is it?
That's aplastic anemia.
Okay, next one. You see absent thumbs plus a global cell line failure.
That is Fanconi anemia.
And what about if only the red cells are missing, but you still see some thumb anomalies?
That's Diamond-Blackfan. Boom. Logic sealed.
So there you have it. The logic for a silent, failing marrow factory is now secure in your matrix. But what happens when the factory is running just fine, but the cells are being hunted down and destroyed out in the periphery? Are you ready for the war that happens in the spleen? That's a whole other mission.